Today I'm going to be speaking about diabetes. What is diabetes? Diabetes refers to a group of diseases that affects how the body uses blood sugar, glucose. We need to understand that glucose is an important source of energy for the cells that makes up the muscles and tissues. It is also the brain's main source of fuel. The main cause of diabetes varies by type. Depending on the type of diabetes you have, it can lead to excess sugar in the blood, which means glucose. Chronic diabetes condition includes type 1 diabetes and type 2 diabetes. We have some potentially reversible causes of diabetes as well, which includes prediabetes and gestational diabetes. So, prediabetes versus gestational diabetes. Prediabetes actually happens when blood sugar levels are higher than normal, but the blood sugar levels are not high enough to be called diabetes. While gestational diabetes happens during pregnancy, but the good thing about this is that it may go away after the baby is born. What are the causes of diabetes? Firstly, we're going to be looking at how insulin works. Insulin is an hormone that comes from a gland behind and below the stomach, which is referred to as a pancreas. And as we know that the pancreas actually has different types of cells, the alpha cells, beta cells, and the gamma cells. So the beta cells of the pancreas releases insulin into the bloodstream. This insulin circulates and it actually allows sugar, glucose, to enter the cells. So insulin thereby lowers the glucose level, and as soon as insulin levels in the blood drops, then insulin secretions from the pancreas also drops. So what are the symptoms of diabetes? It actually varies. It depends if you have type 1 or the type 2 diabetes. Some common symptoms are feeling more thirsty than usual, urinating often, losing weight without even trying, presence of ketones in the urine. What are ketones? Ketones are byproducts of the breakdown of muscles and fat that happens when there isn't enough insulin in the blood. And feeling tired and feeling weak, feeling irritable or having other mood changes, and also having bloody vision or having slow healing sores in the body. Getting a lot of infection as well, such as gum, skin, and vaginal infections. So what are the complications of diabetes? Heart and blood vessels disease, cardiovascular disease, nerve damage from diabetes, which is referred to as diabetic neuropathy, Alzheimer's disease, type 2 diabetes, which may increase the risk of dementia, such as Alzheimer's disease, nerves, and especially in the legs, which can actually cause tingling and numbness. Kidney damage from diabetes, referred to as diabetes nephropathy, eye damage from diabetes, which are referred to as diabetes retinopathy, foot damage, such as heart ulcers and loss of sensation. What are the management? Management of diabetes involves a combination of treatment strategies, which includes eating a healthy diet, staying at a healthy weight, maintaining healthy weight, getting regular physical activities, taking medications for diabetes and other health problems, checking your feet for cuts, for blisters, for red spots and swelling, brushing your teeth and flossing every day, stop smoking, and also keeping track of your blood sugar, managing stress and mental health, using insulin and other diabetic medication when diet and exercise alone aren't enough. If you have any question, you should follow up with your doctor. If you start noticing some signs and symptoms of diabetes, you want to follow up with your doctor as soon as possible for adequate treatment. I hope you're able to learn one or two things from this video. Take care of yourself. Blessings.